AndroPauseSpecialist.com, Section 1. Understanding Andropause. Erectile dysfunction and low testosterone. Evaluating and diagnosing erectile dysfunction. A first appointment should last between 45 and 60 minutes. It should include history. The physician will take a thorough medical history in order to place your erectile dysfunction within a medical context. He will also take a full sexual history. This may include questions such as, how long have you had the erectile dysfunction? What happens when you try to have intercourse? Do you have decreased rigidity? Do you have difficulty maintaining your erection? At what point do you lose your erection? Do you wake up at any point with an erection? How rigid are the nocturnal erections? What is your sexual interest level, libido, like? Does your penis have a curve, bend, or twist in it when it is rigid? Is your ejaculation normal? Is it early, premature, or delayed? What is the status of your relationship? How is the relationship going? How is your erectile dysfunction affecting the relationship? Information. Your physician will explain to you how erections work in terms that you will understand. He will explain why yours may not be working. Physical examination. Your physician will perform a focused physical examination on your penis and testes. In general, you should have a regular general physical examination either before or after your appointment. Evaluation. Your physician will usually measure the threshold for perceiving vibration of your penis, biophysiometry. Depending on your situation, he may perform specialized testing to assess the function of your penis. This may include an ultrasound to measure the blood flow through the penis, a Rigi-scan to measure the quantity and quality of your nighttime erections, a blood test to measure your hormone levels. Once your physician has completed your evaluation, he will review impotence treatment options with you. He will consider these options in light of the history, physical, and specialized testing that has been performed. Finding a doctor for erectile dysfunction. All urologists are not impotence specialists. Urologists are physicians whose training has included specialization in the surgical and medical treatment of the genitourinary system. This includes kidneys, bladder, ureter, the tubes that connect the bladder and the kidneys, prostate, penis, and testes. The conditions that urologists treat include cancer, kidney, bladder, prostate, testicular, and penile, stones, kidney, ureter, and bladder, urination problems, incontinence, benign prostatic hypertrophy, and stricture, trauma, and infection. One of the many conditions is impotence. It is usually one of the last topics listed in a urology textbook and is given little emphasis in urology residency programs. Because of the broad spectrum of areas covered under urology, many urologists specialize in a particular area of expertise. A general urologist must keep abreast of major advances in a multitude of fields, and it isn't realistic for him or her to truly specialize in more than one or two areas. Each year, a small number of urology residents elect to further specialize in the area of erectile dysfunction. These physicians undergo an additional 1 to 2 years of training under the most prominent physicians in the field. They are in the best position to perform a thorough evaluation of an impotence patient. They can also structure their scheduling to accommodate the needs of their patients with erectile issues. Herbal alternatives for treating erectile dysfunction. For many years, yohimbe was considered an impotence remedy. The efficacy of yohimbe has been debated for a number of years. Many studies have concluded that it is no better than a placebo. Others have concluded that it does improve erections, though modestly. It is still occasionally used for men with very modest erectile dysfunction, especially when a lack of desire and psychological factors are major issues. A multitude of multivitamins or herbal supplements are marketed for erectile dysfunction. At the moment, there are no reliable studies that prove the efficacy of any of these medications. The supplement combinations are not regulated by the FDA, and some may be not only ineffective, but also harmful. Some include hormones, which remain controversial when used by patients with normal hormone levels. Herbal supplements must be viewed with a fair amount of caution and skepticism until there is evidence that they are safe and effective.